Namaste students, खुश video. I JV'n Dr. Narendra SHEKHAWAT, Assistant Professor, Department of SHALYA TANTRA, Faculty of Ayurvedic Science, Jayoti Vidyapeeth, Women's University, Jaipur. In previous classes, we discussed about some disorders of kidney. In consequence, today we will discuss about this renal calculus, stones of kidney. Okay, students. Introduction. A kidney stone is a hard, solid mass of material that forms in the kidney from the substance in the urine. Kidney stones or calculi develop as a result of various metabolic disorders which affect the fat of calcium and other minerals elements in the body. Stones may be found in the kidney, urinary bladder, ureter, and urethra. Meaning, a kidney stone, also known as renal calculus or nephrolith, is a solid piece of material which is formed in the kidney from minerals in urine. Statistics. Incidence more than 1 million cases annually in US, 1 in 273 or 3.6 per thousand Americans develop stone annually. 80% of stones under 2 mm in size, 90% of stone pass through the urinary system spontaneously. General stone smaller than 6 mm are passable. Etiology. Diet. Vitamin A deficiency. It causes desquamation of epithelium which acts as a nidus for stone formation. Climate. In hot climate, urinary solutes will increase with a decrease in colloids, which leads to chelation of solute with calcium forming a nidus for stone. Citrate in urine maintains the calcium phosphate and carbonate in soluble state, and any decrease in citrate level in urine cause stone formation. Infection in kidney. Urea splitting organisms commonly cause stone formation, that is E. coli, Staphylococcus, Streptococcus, Proteus, etc. Prolonged immobilization causes decalcification of bones and so hypercalciuria leading to stone formation. Hyperparathyroidism causes hypercalciuria, causing multiple bilateral stones or often bilateral nephrocalcinosis. Hyperoxaluria as a result of altered glycine metabolism. Stasis due to obstruction to urine flow. Renal plaque theory is erosion and depletion of urinary salts as Renal's plaque at the apex of renal papillae. Minute concretions called as microliths normally develop in the subendothelial part of the tubules, which will be carried away as particles by renal lymphatic network vessels. If these lymphatics are blocked, microliths enlarge and act as nidus for stone formation. Others, sarcoidosis, myelomatosis, gout, idiopathic hypercalciuria, hypervitaminosis D, nephroplasm on treatment, hypermagnesuria. AMG plus in urine acts as a complexing agent, prevents nucleation normally. Renal tubular acidosis commonly causes calcium phosphate stone. Stage of stone formation. supersaturation, nucleus formation, crystallization, aggregation, matrix formation, and stone. Then stone. Now, pathophysiology of stone form: urine saturation, supersaturation, crystal nucleation, aggregation, retention, and growth. This is the pathology of renal stone. Students, this is all about the definition, etiology, causes, pathophysiology of renal stone is called stone in kidney or urolith. Okay, students. Remaining part will discuss in another class. Thank you, students. This session is powered by digital version 2.0 Jyoti Vidyapeeth Women's University Jaipur. I hope you are satisfied with this session. If you have any doubts and queries, please mention in comment box. I will resolve it soon. Thank you, students. Namaste, students. I JV'n Dr. NARENDRA SHEKHAWAT, Assistant Professor, Department of SHALYA Tantra, Faculty of Ayurvedic Science, Jyoti Vidyapeeth Women's University Jaipur. In previous class we discussed about definition, causes, etiology, pathophysiology of renal stone. In sequence, in sequence, today we will discuss about types and diagnostic techniques of renal stone to find out renal stone. Let's begin with types. Oxalate stone, also called as mulberry stone, as it is brown in color with sharp projection. It is invariably calcium oxalate stone, show envelope and crystals in urine. Mm, it is invariably calcium. It is invariably calcium oxalate stones, show envelope crystal in urine. Phosphate stones, 10 to 15%. It is either calcium phosphate or calcium magnesium ammonium phosphate stone, usually occurring in an infected urine. It is smooth and white in color. In an alkaline urine. It enlarges rapidly, filling renal calyx, taking their shape called as staghorn calculus. It is radiopaque and attains a large size. Uric acid stones are smooth, hard, yellowish, multiple, and radiolucent. They are seen in gout, hyperuricosuria. Urate stones. Stain stones occur in cystinuria where there is defective absorption of cysteine from the renal tubules. Autosomal recessive condition. It, it is seen in young girls, occur only in acidic urine. It is multiple, soft yellow in color. It attains large. It is radio opaque because it contains sulfur. Xanthine stone are very rare, smooth brick red in color due to altered xanthine metabolism. Here there is deficiency in xanthine oxidase enzyme. Indigo stones, very rare blue in color. Struvite stone, it is a compound of magnesium, ammonium phosphate and mixed with carbonate. It occurs in presence of ammonia and urea splitting organisms in urine. Example, Proteus, Klebsiella. Shape of crystals in urine. Ta- First, types and types correlated with shape of crystal. Calcium oxalate monohydrate crystal shape is dumbbell shape. Calcium oxalate dihydrate shape is envelope shape. Uric acid uric acid shape is yellowish of varying size and shape. Cysteine hexagonal very soft stone. Triple stone shape is coffin lid shape. Clinical features. Pain. Renal pain is located over renal angle, hypochondrium, and lumbar region. Often severe, radiating to grow and testis in male with vomiting due to pylorospasm. Pain worsen on movements. Hematuria is common. Pyluria. Fever. Tenderness in renal angle with often a mass in the loin due to hydronephrosis, which moves with respiration and is bimanually palpable. Bellotable. Smooth, soft, as urinary tract infection. Often hypertension. Investigations. Blood, ESR, serum, calcium, phosphate, creatinine, blood, urea, uric acids. Urine, calcium urate, cysteine if suspected, only pH, specific gravity. Plain X-ray, KUB2C, kind, kidney shadows, stones. IBU to see renal function and hypertension. US abdomen can detect every radiolucent stone and give information about the changes in renal parenchyma. Urine analysis and culture and sensitivity to identify bacteria. Diagnostic studies. First of all, we can do cystoscopy, as you can see in this diagram. Then IVP, intravenous pressure. We can measure intravenous pressure in this. The USG. This is very unique diagnostic tool for renal stone. Treatment part will start in next class. So student, this is about all about the types of renal stone and diagnostic techniques of renal stone. This session is powered by Digital Session 2.0 Jayoti Vidyapeeth Women's University, Jaipur. I hope you are satisfied with this digital session, digital version 2.0, powered by 2.0 Jayoti Vidyapeeth Women's University, Jaipur. I hope you are satisfied with this digital session. If you have any doubts and query, please mention in comment box. I will resolve it soon. Thank you, students. Namaste, students. I, JV'n Dr. Narendra Singh SHEKHAWAT, Assistant Professor, Department of SHALYA, Tantra, Faculty of Ayurvedic Science, Jayoti Vidyapeeth Women's University, Jaipur. In, in previous class, we discussed about types of renal stone and diagnostic tools of renal stone. In today's class, we will discuss about treatment of renal stone. First, let's begin with PCNL, percutaneous nephrolithotomy. Indication stones more than 2.5 centimeter in size, multiple stones not responding for ESWL. Procedure under the guidance of C-arm or ultrasonography. Needle puncture is made in the loin percutaneously through to kidney, calyx and pelvis are approached. Guidewire is passed, graduated dilator are passed, and short track is widened. Then through that a nephroscope is passed. After fragmentation, stone is removed using different methods. Plain X-ray KUB showing phosphate stones in the kidney and oxalate stone in urinary bladder. As you can see in this diagram, stage in PCNL, A, B, and C. This is the percutaneous lithotripsy. As you can see, nephroscope, renal pelvis ureter, and this is the nephroscope. This is the consequence of this percutaneous nephrolithotomy. Here, as you can see in the renal stone, the part of calyx, renal pelvis. ESWL, very important part, extracorporeal shock wave lithotripsy, very important for exam purpose. Piezoceramic electromagnetic shock waves are passed to the stones through water bath or water cushions, which acts as a media. Shocks are produced at 2 per second. 4,000 shocks are required for each stone. Dornier lithotripsy is used for fragmenting stones. Stone is located and observed through fluoroscope or ultrasound. Shock waves are triggered to create compressive waves over the stone to fragment it. These fragments are flushed out later. Advantage. There is advantage, complication, contraindication, as you can see in this. No anesthesia required, can be done as a OPD procedure, less than 2.5 centimeter size. Stones are well fragmented. Hard stones or gray stones are better eliminated by ESWL. ESWL can be done repeatedly in different settings. If it is not successful, one can switch over the PCNL. Complications. Renal hematoma, severe hematuria, injury to adjacent structures, fragmented stone retains in the ureter. Contraindications. Pregnancy, bleeding disorders, patient with abdominal aneurysm, sepsis and renal failure, serum creatinine more than 3 mg per cent. ESW table or machines used for renal stones. It needs C-arm to guide the exact point of stone to be fragmented. This in this pic you can see ESWL machines and okay, this is the same ESWL machine. In this figure, shock waves break up kidney stones. Small piece pass through urinary tract. Simple stones too large to pass through. Conservative treatment. Flush therapy mainly used for lower ureteric stones. Eye fluid injection furosemide 60 to 80 mg. Anti-inflammatory and antispasmodic agents are given to relieve the pain. Surgery for renal stones. Presently, most of the renal stones can be removed without open surgery, PCNL, BSW, but limited factor are cost and availability. Pyolithotomy. Suitable for stone in extrarenal pelvis. Biloin. Posterior subcostal. Incision. Kidney is approached. Renal pelvis is opened, the stone is removed, and the pelvis is closed. A drain is placed and wound is closed. Second, extended pyelolithotomy. In case of intrarenal pelvis, incision is done on the hilum between the pelvis and kidney over the renal sinus. Dissection is carried out so as to remove the stones from pelvis as well as calyx. Nephrolithotomy. By placing incision just behind the most convex surface, stone is removed. Nephropyolithotomy. By making incision both over the kidney and pelvis stone. Partial nephrectomy. Done when there are multiple stones occupying a pole, usually lower pole of the kidney or when there is damage to the calyx. If not removed, may encourage further stone formation. Stones are removed, it is often done in stake-found calculus. In this diagram, you can see surgical procedure. A. Pyelithotomy, B. Extended pyelithotomy, nephropyelithotomy, nephrolithotomy, partial nephrectomy, and coagulum pyelithotomy. Last and final procedure, coagulum pyelithotomy. Coagulum solution, which contains fibrinogen, is poured into the renal pelvis. It is activated so that it solidified whenever entangling the stone in renal pelvis. This entangling mass is removed. This is all about the treatment of renal stone. This session is powered by Digital Session 2.0, Digital version 2.0, Jayoti Vidyapeeth Women's University, Jaipur. I hope you are satisfied with this, with this with this session. If you have any doubts and queries, please mention in comment box. I will resolve it very soon. Thank you. Namaste, students. I, JV'n Dr. Narendra Singh Shekhawat, Assistant Professor, Department of SHALYA, Tantra, Faculty of Ayurvedic Science, Jayoti Vidyapeeth Women's University, Jaipur. In previous class, we discussed about types of renal stone and diagnostic tools of renal stone. In today's class, we will discuss about treatment of renal stone. First, let's begin with PCNL, percutaneous nephrolithotomy. Indication: stones more than 2.5 centimeter in size, multiple stones not responding for ESWL. Procedure: under the guidance of C-arm or ultrasonography, needle puncture is made in the loin percutaneously through to kidney, calyx and pelvis are approached. Guide wire is passed, graduated dilator are passed, and short track is widened. Then through that a nephroscope is passed. After fragmentation, stone is removed using different methods. Plain X-ray KUV showing phosphate stones in the kidney and oxalate stone in urinary bladder. As you can see in this diagram, stage in PCNL, A, B, and C. This is the percutaneous lithotripsy. As you can see, nephroscope, renal pelvis, ureter, and this is the nephroscope. This is the consequence of this percutaneous nephrolithotomy. Here, as you can see in the renal stone, the part of calyx, renal pelvis. ESWL, very important part, extracorporeal shock wave lithotripsy, very important for exam purpose. Piezo-ceramic electromagnetic shock waves are passed to the stones through water bath or water cushions, which acts as a media. Shocks are produced at 2 per second. 1,000 or 4,000 shocks are required for each stone. Dornier lithotripsy is used for fragmenting stones. Stone is located and observed through fluoroscope or ultrasound. Shock waves are triggered to create compressive waves over the stone to fragment it. These fragments are flushed out later. Advantage: there is advantage, complication, contraindication. As you can see in this, no anesthesia required, can be done as a OPD procedure, less than 2.5 centimeter size. Stones are well fragmented. Hard stones or gray stones are better eliminated by ESWL. ESWL can be done repeatedly in different settings. If it is not successful, one can switch over the PCNL. Complications: renal hematoma, severe hematuria, injury to adjacent structures, fragmented stone retains in the ureter. Contraindications: pregnancy, bleeding disorder, patient with abdominal aneurysm, sepsis and renal failure, serum creatinine more than 3 milligram per cent. ESW table or machines used for renal stones. It needs C-arm to guide the exact point of stone to be fragmented. This in this pic you can see ESWL machines and okay, this is the same ESWL machine. Shock in this figure, shock waves break up kidney stones. Small piece pass through biliary tract. Simple stones too large to pass through. Conservative treatment. Flush therapy mainly used for lower ureteric stones. Eye fluid injection furosemide 60 to 80 mg. Anti-inflammatory and antispasmodic agents are given to relieve the pain. Surgery for renal stones. Presently, most of the renal stones can be removed without open surgery, PCNL, BSW, but limiting factors are cost and availability. Pyolithotomy. Suitable for stone in extrarenal pelvis. Biloin. Posterior subcostal. Incision. Kidney is approached. Renal pelvis is opened, the stone is removed, and the pelvis is closed. A drain is placed and wound is closed. Second, extended pyelolithotomy. In case of intrarenal pelvis, incision is done on the hilum between the pelvis and kidney over the renal sinus. Dissection is carried out so as to remove the stones from pelvis as well as calyx. Nephrolithotomy. By placing incision just behind the most convex surface, stone is removed. Nephropyolithotomy. By making incision both over the kidney and pelvis stone. Partial nephrectomy. Done when there are multiple stones occupying a pole, usually lower pole of the kidney or when there is damage to the calyx. If not removed, may encourage further stone formation. Stones are removed, it is often done in stake-found calculus. In this diagram, you can see surgical procedure. A pyolithotomy, extended pyolithotomy, nephrolithotomy, partial nephrectomy, and coagulum pyolithotomy. Last and final procedure, coagulum pyolithotomy. Coagulum solution, which contains fibrinogen, is poured into the renal pelvis. It is activated so that it solidified whenever entangling the stone in renal pelvis. This entangling mass is removed and removed. This is all about the treatment of renal stone. This session is powered by Digital Session 2.0, Digital version 2.0, Jayoti Vidyapeeth Women's University, Jaipur. I hope you are satisfied with this, with this with this session. If you have any doubts and queries, please mention in comment box. I will resolve it very soon. Thank you.